Welcome everybody to our weekly chat with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course. Happy to be here.
Thank you so much. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, as we wait for people to join us, let me quickly explain how this works. Every week, we put out a call on our social media for you, our audience, to send us questions, and we collect all of those questions and present them to the doctor. She's never seen the questions before. She's answering them right off the bat. And if you haven't had a chance to submit your questions, you can still do that. It's not too late. We'll try and take as many questions as we can live. You just have to submit them in the comments under this broadcast. And we have about a half an hour with the doctor, and we'll try to get to as many questions as we can. So, doctor, are you ready for another week of interesting questions?
Yeah, let's hear them.
All right, so let's go. Let's start with more vaccine questions. We've been doing this for a few weeks now because vaccines are top of mind for so many people. Let's start with Gerald. Gerald asks, the vaccines require 2 doses to be 95% effective. Can you be injected with one of each of the 2 vaccines, so Moderna and Pfizer right now, without any side effects?
Okay, so the recommendations are from the National Advisory Committee on Immunization that if you start the series with one vaccine, you complete it with the same vaccine as much as is possible. Now, if we run into a place where we will never get Pfizer vaccine back, then you could complete the series with a similar type of vaccine. So right now, the Pfizer and Moderna vaccine are both the messenger RNA vaccines. And so if you were in a pinch, you could complete the series with the alternate vaccine. But the recommendation is really as much as possible to complete the series with the same vaccine. Right. And the reason for this is we really don't know. While we know that they're similar vaccines, we really don't know that the results. Now, the recommendations are based on expert advice, but so as much as possible, complete the series with the same vaccine.
Right, of course, because again, you're not, one is, you take 1 dose and then the second dose is a booster. So we're not sure if that might work as a booster, right? Like if it's a different vaccine.
Yeah, and it probably will work, but if we have a choice, let's go with what we absolutely know in this case.
Right, okay. And then Wings asks, Wings is a regular contributor to our Q&A. They ask, since most attention was given to the vaccine rollout, are there treatment plans for current and post-COVID victims?
So there are still treatment trials that are undergoing to figure out the best treatments, of course. Yes, I mean, that is not going to stop despite the fact that there is a vaccine that's available. And so, again, you can imagine the treatment plans are varied. If you have a mild illness, a moderate illness, hospitalized for a few days and then sent home versus in the ICU, the treatment plans will be very different in all of those situations. And so there has been no stopping of trials for treatments at all. Absolutely not.
Okay. And then these are similar questions from Alice and Manuela. So I'll read out Alice's first. She says, my dad is 82 years old and has some underlying health problems. His family doctor, of course, recommends for him to get the COVID vaccine. When can he expect to get it? Is there a list that he can be put on?
Right. So it's not going to be like, okay, I want the vaccine, let me go on a list, and then you'll be guaranteed to get it. Right now, the prioritization is actually, there are active conversations from many different levels of groups talking about this. And so once stage 1 is over, stage 2 will start. And we've seen in other places around the world, like the UK prioritizes age, and then other sectors. The province has come out and said that in that stage 2 will be some age, some essential workers, healthcare workers, for example. So we'll have to wait and see what exactly comes out, how much vaccine we have. That's also going to determine how fast we can roll out into that second stage. How will you know whether your time has come? I think it's going to be many ways. If it's going to be age-based, watch the news. It's going to be clear where you can go to get it, and then it will be some sort of identification of your age to guarantee that you're eligible. But again, those fine details haven't been sorted out yet either.
Okay. And then Susie asks, again, it's a timeline thing. When will childcare staff get vaccinated? Are they in the second tier?
So essential workers were listed there. Teachers were certainly listed. Often teachers in childcare are considered very similar. Often they work in very similar environments. But again, we don't have a lot of those specific details yet. But certainly essential workers were listed in the second stage.
Okay. And then we've got a question coming in live right now. Mrna asks, Mrna says, what is the criteria to choose which vaccine the person will receive? Is there any criteria?
So right now with the Mrna and the Pfizer vaccine, they're both these messenger RNA vaccines. So the vaccines that give you instructions to produce antibodies. And they actually have very similar ingredient lists. They're slightly different, but by and large, they're quite similar. And so if you had a contraindication to Mrna has one ingredient called tromethamine, which is if you're allergic to dyes or whatever, then Pfizer might be a product for you in that specific situation. But by and large, 94 versus 95% efficacy, they both work very well. And so there's really not a lot of choice that's being offered per se. A lot of it is based on what's available and the logistics of where you can get your vaccine.
Right, absolutely. And then, okay, let's go back to the questions we have submitted here. Jim asks, what are your thoughts on the Oxford Astrazeneca and Novovax vaccines compared to the new untested mRNA vaccines?
So the AstraZeneca and other vaccines that are coming down the pipeline are currently under review, some of them with Health Canada. They have not been licensed yet. So until they're licensed and we kind of really know more about some of the trials, the studies, the data, the side effects, even how well they work, it's really hard to comment otherwise, especially in comparison to the messenger RNA. I think it's important to note that really any COVID vaccine is a new vaccine. I mean, we haven't had COVID vaccines before. They are using technology that has been used and has been tested before. And so while the messenger RNA vaccine has been used, for example, for cancer treatments previously, so that technology is not brand new. It has been used in medicine in other ways. And same with the messenger RNA or the AstraZeneca is actually using an adenovirus vector. Now, these are very complicated medical terms, but to say that it works in a different way as well.
Right, so that's not an mRNA vaccine, the AstraZeneca one. It works in a whole different way.
That's right. It uses a type of adenovirus as a vector, so that's how it attaches to it to actually get your immunity going. So it's a very different type of technology for the vaccine.
Okay. And then Ed asks, we've had this question before, but it bears repeating. Ed asks, can people with COVID-19 take the vaccine currently having COVID-19?
So if you're currently infected with COVID, you're isolating, you're infectious, you're contagious, we don't recommend that you get vaccinated in that setting. But if once you've recovered, you're no longer contagious, you're healthy enough, like that you've recovered, then you can certainly get vaccinated. There is a recommendation from the National Advisory Committee on Immunization that says that if you've had COVID within 3 months, you could consider delaying it if there are vaccine shortages. So some places are doing that because we certainly do have shortages. But for logistical reasons, if you've had COVID and now you're offered the vaccine, you can certainly still get it. That is the recommendation.
Okay. And then Mariam asks, this is again quite a common question. We've got this a few times. Mariam asks, what are the common side effects of the vaccine and who is liable in case of serious side effects?
Okay, so whenever you get a vaccine, it's always about informed consent. And so no vaccine is 100% safe. No medicine, and really nothing in medicine is 100% safe. There are always benefits and risks. And so what you have to do is evaluate, well, what are the risks of getting COVID? We know that right now, COVID rates are very high. If you got COVID, some people get quite sick with it. Some people actually die from COVID. If you got the vaccine, there are still risks of side effects. With all vaccines, the commonest side effects are local. I had a very sore arm for a day and a half when I got vaccinated, and I didn't have any other symptoms. But some people can feel unwell, can get a headache, and can feel nauseous. after the vaccine can get some swollen glands. Those, though, tend to be short-lived, and people tend to recover from them. Now, the severe reaction is that anaphylaxis, that severe allergic reaction. But in the clinics where you get your vaccine, they're trained to be able to detect that and to be able to treat it properly to prevent that side effect. And so there is, though, on the point of, well, who's liable? I mean, it's about informed consent. You can't always predict who's going to get a bad reaction, but Canada did announce in December, I think it was in December, that there was going to be a national vaccine injury compensation program, recognizing that you get vaccinated to help the community as much as to help yourself in most cases. And so if you were to get a severe side effect from the vaccine, that there would be this compensation program to help. And so I haven't seen additional details on that, but that's another piece of information that will be important as we go forward.
Right, absolutely. And then Doug and Brian actually have a really similar question. So let's do Brian's. If I had COVID, don't I already have immunity, which is exactly what the vaccine does? So how long does the vaccine's immunity last? And do I have to get it yearly, like a flu shot, for example?
Yeah, so if you had COVID, we know that your immunity can last for 3 months or so, maybe longer in some people, but in some people it doesn't last longer than that. So, it doesn't seem that lifelong immunity comes when you've had a COVID infection, at least not in everyone. And so that's why the vaccine is still recommended. Now, we only know that the immunity for the vaccine lasts as long as we've been able to study it so far, a few months so far. But so far, based on the studies, the immunity, the antibody rates are still high, even a little while after the vaccine, a few months later. And so that's something that we'll watch for. Will we need annual boosters? Will the same vaccine work if we have variants? Maybe we will need to be revaccinated because of new strains of COVID that are being circulating. We don't actually have all of those answers, but right now what we have is a vaccine that will help us in the short term and will give us more information down the road.
Right. And so, I mean, the long and short of it is, even if you've had COVID, taking the vaccine, it does no harm. You should take the vaccine.
It is safe for you to get vaccinated if you've had COVID. That's right.
Okay. All right. Then let's go to Carol. Carol asks, she has a two-part question. Firstly, is this a live vaccine? And secondly, if someone has an autoimmune disease such as chronic or ulcerative colitis, can they safely take this vaccine?
Okay, good question. So it's not a live virus vaccine. We do have some of those, like the measles vaccine is a live virus vaccine. If you are on an immunosuppressive drug, so a drug that suppresses your immune system, which could be the case if you had ulcerative colitis, we do not recommend that you get measles. The measles vaccine, not measles or the measles vaccine. This vaccine is a messenger RNA vaccine, and so what it does is when you get the vaccine, you get instructions for your body to make antibodies. You cannot get COVID from the vaccine. Your body gets instructions to make the spike protein. Once it has a spike protein, it then makes antibodies against the spike protein. But the spike protein itself is not enough to make you sick. Very sick. Now, you can feel unwell after the vaccine, but that's actually because of the immune response, because your body's actually trying to produce antibodies. Yes. So if you have ulcerative colitis or an autoimmune condition, what you need to do is to talk to your treating healthcare provider, your physician or nurse practitioner, to ask them whether the vaccine is recommended for you. If you're on some of these really strong drugs that can suppress your immune system, you might want to time the vaccination based on when you're getting your next dose of medication. And so to get that informed consent conversation.
Okay, perfect. And then we've got a live question coming in from Karen, just referring to something you just said. She says, so you're only protected for 3 months with the vaccine as far as we know so far?
As far as we know, it's only as far as the studies have been tested. We can't say that you have 1 year of protection because we actually haven't had the vaccine around for 1 year. So we're certainly not trying to state more than what we know. But I don't think that, based on the data so far, that there's a reason to believe that the vaccine is not going to provide more. It looks like it's going to provide more protection than that. We just can't give you the answer until we've been able to pass that hurdle.
Right. So far we've studied it. We have 3 months of data. That's what we know so far. And I don't suppose you could definitively say anything more because we don't know.
That's right. That's exactly right.
And then I guess coming back to the booster doses, then if it were that it was only going to last for 3 months, would it be possible as a hypothetical even to say that every 3 months you'd have to go and get vaccinated?
I think if the vaccine only lasted for 3 months, by now we would have evidence based on the people who were in the study that actually after 3 months the immunity drops and you need a booster dose. So I think we can predict that it's going to last longer than that. But will it last a year? Will it last 2 years, 5 years, 10 years for life? I mean, we don't have those answers.
Right. Okay. Let's go back to the submitted questions. We're done with vaccine questions for now, but if you have more questions, please continue to submit them. Let's move on to some other questions here. Danuta asks, I would like to know the number of cycles that PCR tests are using that are performed in Ontario, and is it uniform across Canada? It's a popular question. We get it a lot.
Yeah, so this is about the cycle threshold. And, what I've said here is that it's on average of around 30. But again, each lab has their own threshold that is used. The point of this test is really if you have a positive and it doesn't quite make sense, the person has no symptoms, maybe they were getting tested as part of their work, like they work in a long-term care home on a weekly basis. And you're trying to figure out, is that a real infection? Is it not a real infection? A cycle threshold test can help you differentiate that, but it's pretty lab specific, and so that's why there's while there are parameters, you have to actually really confirm with the lab, but it's around 30 is the cutoff that we are using.
Okay, so definitely not uniform across Canada because, like you said, every lab does their own threshold. Okay, Michael Griffiths asked, this is a testing question. We had this early on in the pandemic, but let's talk about it again. Michelle asks, why do you have to scrape so far inside the nose cavity to get a sample if just coughing and sneezing and breathing can spread the virus so easily? Shouldn't you be able to get a sample from someone just coughing in a petri dish?
Yeah, so nice question. A lot of people are getting tested before they even have symptoms, actually. So if you were a close contact of someone, we recommend that you get tested on day 5 or 7 after you've had contact. And by then, many people actually don't have symptoms. And what we're trying to do is trying to determine, could you be incubating? Are there signs that you are going to develop the virus?
Right.
And we know that by getting that deep nasal, that nasopharyngeal swab, we're more likely to pick up any virus that may be brewing, that may be incubating and starting to infect. That's why we do that test. Yeah. Now, compared to in March, we have more ways that we can do that test. And we know that parents don't like to do that test for children, and I completely understand. Though I did do one in a child this weekend who didn't even cry, but it can be quite it is not comfortable for a lot of people. And so there are saliva-based tests. You can do a test of the front of the nose and a throat swab. So there are other ways to collect the specimen. It's just those other ways that collect it can sometimes miss the virus. And so that's why if you had a choice, it's that deep nasal swab that you would prefer. But if it means that you're not going to get tested, well, then it's worth figuring out whether you could go to a place that can collect a saliva sample, for example.
Right, absolutely. And then actually based on that, I guess, Ken asks, Thermobright just released great results around saliva tests for COVID. Is there a plan to implement large-scale saliva testing in Ontario or Canada?
I can certainly say that I would love to see that. I mean, we have certainly in Toronto done some schools where there was a pilot with saliva-based testing. Sometimes it was actually they took home kits. The students took kits home, collected the samples and brought them back. And a lot easier to do, a very good uptake from the students themselves. And so I think understanding if we can roll this out, if more labs can have capacity to do the saliva-based testing, if there's a point of care saliva test, I think this is certainly something that is on our radar to keep track of. What we don't want, though, is to use a saliva test that only works half the time, that has lower test characteristics, because then we'll be missing COVID and we'll get that false sense when we get a negative to say, oh, it's negative, but actually it was an incorrect test. So this is part of what we're trying to balance.
Right, absolutely. And then, okay, let's do some travel questions. Rima asks, does a Canadian citizen traveling to Toronto from Greece with a valid PCR negative test still need to quarantine for 14 days upon landing?
Yes, absolutely. There has been no change in that from the federal government. In fact, based on the variant, we may see some of that change, but I imagine that it will become a more stringent rather than less stringent, because the fact that we have the variant virus here is really indicative of travel, even though we've had restrictions in place. So a negative test, again, a negative PCR is only valid really on the day that you get tested. And by the time you fly over and then you come here and you get home, a few days later, that negative test is really meaningless. And so that's why it's really important to quarantine.
Right, absolutely. And that's why they say you need a negative test within, I think, 72 hours or so of boarding your flight, because it's only good for that small little period of time.
Yeah. Now, that being said, there are some, there are some studies that are undergoing to see if there can be a broader test-based approach for travelers. If they get tested on day X and day Y, and they're negative on both of those occasions, can they be cleared from quarantine sooner? So some of those tests are, those studies are being done. And so there may be more of that kind of an approach into the future as well.
Okay. And then let's see, Maria has an interesting question. If you are positive, if you test COVID positive and then you do your quarantine and everything and you're released to continue with your activities, and then after a month you need to fly, are you going to be allowed to fly, since for up to 3 months you can still be shedding the virus and you can still test positive, but you need a negative test in order to fly, and almost every country is asking for a negative test?
Yeah, I can see this discrepancy, right? And sometimes then if you test positive, it's actually, a weak positive because you previously had the infection. I think the way to understand it, though, is the airlines are trying to take lower the risk as much as possible. And so while it may not always be the best science, they're trying to implement something that way. I'm not aware whether there's an alternative if you've had COVID in the past 3 months. I'm not aware of that, and I think you would have to ask that question to the airline. But really, the answer is stay home. Really, right now, don't plan to travel, don't plan to go anywhere. Really, even if you've had COVID, the best place for you is here at home.
Yeah, absolutely. And I think when it comes to airlines or when it comes to regulations like this, you have to try and maximize, what's best for as many people as possible. So the exceptions for, oh, you had COVID 3 months ago, you're still shedding, all of that. I don't know if you can make tiny little exceptions for people like that, because then it would be endless, right?
It's hard to implement that. That's for sure. Yeah.
Exactly. Okay. Kathy is very concerned. Kathy says she doesn't think that the health department is checking in on people who have traveled. Who is making sure that they quarantine for 14 days?
Yeah, so actually, it's not the health department's role to check in on people who have traveled, actually. The health department, like Toronto Public Health, our role is for people who have tested positive. For people who have traveled, that actually falls under the federal government. Under the Quarantine Act. Now, they do have a lot of things in place. They have someone calling, they have an app where you have to check in. So they do have a lot of mechanisms in place and have actually said that they're getting very good compliance from travelers. But in terms of the responsibility, it falls upon them, the federal government.
Right, absolutely. Okay. Okay, some just moving around in lockdown questions. Wilsey asks, can I drive across Toronto to visit 4 friends in a park? It doesn't seem like it's in keeping with the stay-at-home order, but then why do they say that groups of 5 can meet in an outdoor setting?
Okay, so what I would say to you is I would not recommend it. I do recommend that you stay at home as much as possible. There are allowances for, meeting outdoors. Some people are still getting married, for example, or, like if there are kind of exceptional circumstances, if someone lives alone and needs to connect with someone, well, they can connect with someone outdoors, keep their distance. That's part of the reason why that those allowances are in place. They're certainly not in place to just generally socialize. I think if you have a choice, I would stick with virtual. I would stick with, being outdoors for good physical activity within your neighborhood as much as possible, and just with the people that you live with.
Yes. Okay. And then Sue asks, similar question, I guess. If you have a mask on, can you take somebody who doesn't drive to get their groceries?
So being in a car, actually, we've seen COVID spread through carpooling, people who are going to work, and it's a very common thing. It's actually a necessity for some people. It's very difficult to avoid, but COVID has spread in those settings. So I think we have to realize that when we're taking people, maybe the better thing is that you take the list and do the grocery shopping for them and drop it off. I think that's the safest option, or to consider online delivery. When you're in a car together, I would recommend that you both be masked. One sit in the front, one sit in the back, keep the windows open. That will lower the risk. But again, there is definitely a higher risk of sharing a car together, especially with someone you don't live with. Right,
absolutely. And that was the recommendation early on too, all through the summer, even before that. If you're sitting so close to each other in a car, it's going to spread if one person has it. It's very hard to avoid that.
Mm-hmm. And you know what, I wanted to also mention the question before about, driving across town and meeting with friends. There are actually stay-at-home orders that are actually 3 pages that explain what are the reasons in which you could leave the house. And so I think that's worth going to. It actually clarifies, if you're going to help someone in need, if you're going for an essential job, it does actually clarify what is allowed under that. So I just wanted to add that piece in as well.
Yes, absolutely. And we know that officers are allowed to ask you for ID, and they are allowed to ask you, for certain things, and you do have to comply to those things in case they think that you're outside for a non-essential purpose. So there are risks to it. Of course, nobody's going to fine you for no reason for being outside if you're exercising or something, but we do know that those enforcements are in place right now.
Exactly. So it's before you make those decisions, first pick the lower risk, preventing COVID, but there are also some legalities here as well too.
Yeah, absolutely. Okay. So JEC has an interesting question here. When people are asked to stay at home and not gather outside their households, how are we stopping the spread of the virus if one of the people from the household is going outside for work and is being exposed to other people? Even with wearing a mask, social distancing, that kind of thing, the chances of bringing home the virus are still there. And so what are the recommendations there? Does it mean that they don't visit anybody else? How do they prevent the spread?
So definitely don't visit anyone else. Yes, we should all be staying at home. If you work in an essential workplace, you are still permitted to work there. But the workplaces themselves should have very good measures in place to prevent COVID there. So that, and then while you're at work, it means wearing your PPE appropriately, keeping your distance, so that you are lower risk for actually picking COVID up and bringing it back to your home. So there's a number of different layers of ways to prevent COVID from spreading among those essential workers.
Right, absolutely. And then actually we have a live question coming in from Karen again about the variant. She says, have you noticed this new variant? And they're now recommending better masks such as N95s. Is that a recommendation, or will that become a recommendation soon?
So the variant, yes, is in Ontario. There are actually 3 variants. There's the UK variant, Brazilian variant, and South African variant. Those are the 3 commonest ones anyways. There may be even more than that. So the UK variant has been identified. What we're recommending actually is the same measures that have been in place, but being more rigorous about them. So there's no recommendation that everyone wear an N95 mask. I think I've explained before too, but wearing an N95 mask may actually, it's actually hard to do. And unless you actually, and there are certain circumstances where you are required to wear an N95, you know, with aerosol generating procedures for sure. But we have to make sure that the measures that are in place, that we continue those and we don't lax on them at all. But there are also other things that we can do in terms of, you know, if someone has COVID, how to prevent it, if someone's in contact with someone, how to prevent it. So we are certainly actually getting updated guidelines on that so that we can implement them. But more to come. I mean, if an N95 is what's required, you will see that recommendation come up, but that's not what I've seen so far.
Okay. And then actually, let's talk about the variant then. Kevin and Anonymous have similar questions. Basically, how are the variants 50% easier to transmit? Are they more dangerous? Do they spread more quickly? Do they cause more deaths?
So all very good questions. For the UK variant, we have heard and actually seen evidence that it is more transmissible, 30 to 50% more transmissible. In terms of the severity, I know that the UK said that it's a more severe virus. But I haven't seen much more other than that. I think the one thing to note about that is if 50% more people are getting sick, and we know that say 10 to 15% of people may end up in hospital with COVID, well, then you're going to see more people get more severely sick just because more people are getting infected, for example. But I think the key point is that it's more transmissible. And so the public health measures that we have to be even more confident with them, use them to the maximum ability in order to prevent the spread.
Doctor, we've been talking about public health measures now for so many months, and you know they're all in place. There's so many different things that we have to do or not do, rather. What else can be done in terms of, because for example, for myself, I don't leave the house. How much more can I not leave the house? What other measures can we even expect now that we've already put in so many stringent measures?
Yeah, so I think we're going to see what other measures we can put in place. But I mean, when you do leave the house, do you see people with their mask under their nose? I mean, that's a perfect example of how, while we all know that we need to wear a mask, we're not all wearing the mask properly. Are we all wearing a 2+, you know, even a 3-ply mask? That might be more effective. Staying home when we're sick. So we know about the measures. We can probably recite them. Keeping that physical distance at all times, well, that's going to be even more important. Even when we are going for our walk, when we see our neighbor, we just, you know, say hi and then connect virtually afterwards. So I think that's more of what we're talking about, is being more consistent in the measures that we know and applying them at all times.
Right, absolutely. Okay, we don't have a lot of time. Let's do this one. Natoya asks, I got COVID-19 on November 17th, and till today I have a headache. Taking a number of medications. We did a CT scan, and my family doctor still doesn't know what's wrong. Why do I still have the symptoms?
Yeah, so I'm really sorry that you're not feeling well for such a long time. What I would suggest is that you continue to follow up with your family doctor to figure out, could it be the effects of having had COVID? Could it be from something else that's going on? What kind of medications or puffers, or for example, that you can use to treat the symptoms that you have? And I hope for you that your symptoms do feel better soon. We are hearing about this, that people who have had COVID can have some lingering effects, some more serious effects from the virus itself, even weeks or months later. And so please do follow up with your doctor. And I really do hope that you feel better soon.
Right, absolutely. So on that note, we are at 1 o'clock. Actually, we're past 1 o'clock. So thank you, doctor, for staying on for the extra minute. And thank you so much for your time. Thanks to everybody that submitted their questions live. If you didn't have a chance to get a question in this time, we'll see you next week. Thank you, doctor.
Bye.
Bye.